Hey everyone, Diana here, and you are watching In the Pink, where we are your resource to help you find answers to your women's health questions. So if you're new to this channel, I hope you consider hitting subscribe so that you always know where to find me for your women's health questions. Today we're going to talk about melasma. Now melasma is something that can develop anytime during your life, but oftentimes it develops during pregnancy, and for that reason, it's also known as a pregnancy mask. Welcome back to my channel. My name is Diana and I'm a physician assistant specializing in women's health. So today's topic is about melasma. Melasma is a darkening of the skin on the sun-exposed areas of the face. This may look like dark patching on the forehead, the cheeks, the nose, even the chin. You can also have it on the chest and the arms, but that is by far less common. Melasma can be a dark brown color, it can be a light brown color, or sometimes even a grayish blue color. The exact cause of melasma isn't known for sure, but we do know of some things that tend to contribute to your risk of developing melasma. One might be if you have darker skin, the amount of UV exposure that you have, and hormonal factors such as being pregnant or even being on birth control pills. There are certain seizure medications that might also increase your risk of developing melasma. There aren't any special tests that your doctor or PA or NP need to diagnose melasma. They might just ask you a few questions and do an exam. Melasma affects women over men 9 out of 10 times. For the women who do develop melasma, 25% of the time it's due to your pregnancy. Most of the time, the melasma will lighten up after the pregnancy is done. But if it doesn't, there are some things that you can do to try to lighten it up yourself. There are several different ways to treat melasma. Not everybody responds the same way to each type of treatment, and some people need to do more than one treatment to really help. The first treatment is avoidance of sun exposure. This doesn't mean don't go out in the sun at all. What it means is that you want to make sure to wear proper protection, especially on your face and your chest and your arms. Wear wide-brimmed hats. Use sunblock. Most providers will recommend at least an SPF 30 or higher. You can try an over-the-counter skin lightening cream. Now it's important to note that not every cream is the same and it may not work the same for everybody. You really should use an over-the-counter cream cautiously, especially if you tend to have sensitive skin. I think it's a good idea to consult your medical provider before trying anything too strong. Below I've put a link to a few of my favorite creams. Not only can they help with melasma, but they help with freckles as well, so I like them. If an over-the-counter skin lightening cream doesn't work, you can get a prescription strength cream from your medical provider. There are several different types of creams and your medical provider can help determine which is the best for you. Some of them, however, are not safe during pregnancy, so make sure you tell your doctor if you are pregnant. If a skin lightening cream doesn't work as well as you want it to, your doctor might prescribe a chemical peel. A chemical peel is where a strong chemical is applied to your face that essentially makes the top layer of the skin come off, hopefully revealing the new healthy skin underneath and lighter melasma. If you don't see a response with the chemical peel or with the skin lightening creams, you might be referred to a dermatologist who could do a laser treatment or a light-based treatment. Now these treatments must be done carefully and only by a dermatologist, because if they're done wrong, it can cause other skin problems or it could even worsen your melasma. Even after your melasma has been treated, you need to be careful with sun exposure because it can return. You can prevent that from happening by consistently wearing a sunblock protection. Remember, you can get sun exposure through the clouds or even inside through a window. So I recommend that you wear sunblock daily, year-round. It's best to put on sunblock at least 15 minutes before you go outside, and don't forget to reapply. It's best if you choose a sunblock that has zinc oxide or titanium dioxide in it to protect you the best from UV sun rays. As I mentioned before, having a wide-brimmed hat to wear on those sunny days will also help protect you and prevent the return of melasma. Some other things that you can do to help reduce your chances of getting melasma or help prevent it from returning is to use gentle skincare products. Harsh skincare products that cause stinging and burning might cause your melasma to get worse. Also avoid waxing in areas where melasma tends to develop. Waxing can create irritation on the skin that might also help melasma to develop. Thanks for watching my video on melasma. If you found it informative, if it was helpful for you, please hit the like button below. And if you have somebody that you know that's struggling with melasma themselves, share it with them. It might help them as well. As always, click the subscribe button below so you always know where to find me for your other women's health questions. The question that I have for you is, If you have melasma, what's worked for you? Have you tried over-the-counter skin lightening creams? Have you tried chemical peels? Have you tried laser treatments by your dermatologist? I'd like to know what worked, and let me know what didn't work. Let me know in the comment section below. Thanks, and we'll see you next time.